Okay, fantastic. Good morning, class. So, I'm feeling a little bit better than I did yesterday. So, I'm going to talk about um, medical specialists and case reports. I know that O looks like an E. So I'm closing. Okay. And not be on two sides. Okay. You know what? I'll leave that one right over there. So now, is everyone on page 175? Okay, okay, fantastic. Okay, so page 175. So this um, learning of med terminology gets a little bit more deep, especially for those that's going into billing and coding. Okay. So now you learned your combining forms, you learned your suffixes, your prefixes, your root words. We went back to grammar school. So now we're layering everything together. You learned the different positions of the body, the posterior, anterior, um, different things of that nature. You're learning all of that. So now it's time to put it all together, okay? And everything is learned in layers. And that goes with anything in life. Everything is learned in layers. So in chapter 5 of your chapter book, this is the book I'll be lecturing from today. More paper. I was making copies. I deal with that later. Okay. We're going to deal with medical specialist, combining forms and vocabulary, case reports, in person living with Crohn's, a person living with Crohn's disease. We're going to look more in depth with that. Exercise and answers, pronunciation of terms, practical applications, review and terminology checkup. Okay, so this chapter will describe the training process of physicians to identify medical specialists and describe their specialties. To identify combining forms using in terms that describe specialists, to decipher medical terminology as written in case reports, okay? All right, so let's move on to page 176. So now we read the introduction. I'm gonna let y'all look at that at your leisure. And now it talks about medical specialists. And so doctors must complete 4 years of medical school, then pass a national medical board examinations to receive an MD, and that means medicine or doctor of medicine. They may begin postgraduate training, which lasts at least 3 years and in some cases longer. This postgraduate training is known as residency training. Examples of residency programs are anesthesiology, dermatology, emergency medicine, family practice, internal medicine, ophthalmology, pathology, pediatrics, psychology, radiology, and surgery. Okay? Now, examinations are administered after the completion of each residency program to certify the doctor's competency in that specialty area. A physician may then choose to specialize further by doing a fellowship training. Fellowship programs lasting 2 to 5 years train doctors in clinical and research skills. So, for example, an internist, which specializes in internal medicine, may choose fellowship training in internal medicine specialties such as neurology, nephrology, endocrinology, and oncology. A surgeon interested in further specialization may do fellowship training in thoracic surgery, neurosurgery, or plastic surgery. On completion of training and examination, the doctor is then recognized as a specialist in that area of medical practice. So now we see all of these different types of specialists on page 177. And just to list a few, you have allergists, you have gastroenterologists, you have hematologists, infectious disease, you have geriatrician that deals with the elderly at the old age, neurologist, neurosurgeon, oncologist, ophthalmologist, orthopedist, psychiatrist, pulmonologist, radiologist, thoracic surgeon, rheumatologist, and urologist, and so on and so forth. So there's a nice lengthy list of different types of physicians that specialize in care. Okay, and as I stated to you, medical billers once before, depends on where you're working, is what you may want to specialize in. Okay, and you have to make sure that your position is within their scope of practice. Okay, all right. So looking at page 178, here are two groups of matching exercise for practice with new terminology. So I think we kind of touched on that a little bit the other day. So I'm going to let y'all look at that on your own free time. And we're going to move forward. Let's see here. Let's go on to, we're going to move on from there. And we're going to move on from there. Okay, so case one on page 184. Case one on page 184. Okay, we have here's a short case report related to medical specialties. Many of the terms will be familiar to you. Others are explained in many dictionary, which is beginning on page 341. For every case report, write the meaning in bold-faced terms and spaces provided. Okay, so case one, cardiology. Cardiology. Mr. Rose is admitted to the cardiac care unit, the CCU, with angina and a history of hypertension. A coronary angiogram shows spasm of the right coronary artery, causing acute myocardial ischemia. The electrocardiogram showed ventricular arrhythmias as well. Nitroglycerin is administered, and within minutes, the angiogram showed reversal of the spasm. The ECG recorded reversal of life-threatening arrhythmias as well. To prevent further ischemia and myocardial infarction, Mr. Rose's treatment will include antiarrhythmic, diuretic, and anticoagulant drugs. In the future, he may need an additional procedure to place a stent in his coronary artery to keep it open. Okay, so looking at the case here, and I think I've given y'all some assignments before online where y'all go and highlight different medical terminology terms to kind of help you be familiar with that within that case report. So now we have these different terms here that we're going to define later on. So we have case one, case two on page 186, case three on page 187, case four on page 188. So we have all these different cases. All right, now, the reason why I had you all to look at the different cases on the online assignment homework is that, for one, to be familiar of medical terms within your scope of billing practice towards that position. Two, be familiar for coding purposes. When to code for openings, removals, incisions, and the actual work of the gland and or the organ. Okay. Also know how to bill for the professional services of a physician. Be it inpatient or outpatient. Okay, those are the main purposes of why you have to learn about coding cases. Okay, now one day you may want to be an actual coder in a hospital setting. You have so many cases per day, and depends on how big those cases are and your responsibility. You may have 5, 10, or 15 cases per day to complete. Okay, everybody is on what they call production. Okay, everybody has to meet a certain standard of production that shows proof of your work. Okay, making sure that you don't just sit around and twiddle your thumbs. Okay, you're supposed to stay busy. Now, sometimes, depends on the case, you're not going to always finish all 10 or 15. Sometimes you may have a lengthy day where you're going to case for a long time, and then the next day you may have a pretty good day where you're just getting through and you can make up for what you missed on yesterday. But long as it adds up at the end of the week that you've met your productivity, okay? If not, then you have to give an account as to, and it's not to get you in trouble, it's just give an account as to what went wrong, what information was not quantified or qualified for you to code and complete the process to move on to billing, okay? Remember when I said that in billing, you have two different types of billing, okay? And you're going to learn that. Okay, outpatient, like an A, outpatient and inpatient. Who said that? Shaylee? I heard you. Very good, Shaylee. And inpatient, okay? And another term for inpatient is acute care. Okay, so if you go on an interview and they say, do you have any acute care coding experience? The answer is yes. It's interchangeable. So inpatient, acute care, same thing. Okay, so just be aware of that. Okay, outpatient. So let me further define outpatient for you. That could be in a physician's office, uh, outpatient surgical center, radiology, and even pathology, okay, like forensic pathology, okay. Inpatient, along with the outpatient, they use Hicks-Picks codes. We'll talk about what Hicks-Picks codes are. CPT, we'll talk about what that is. ICD-10, we talked about that before. Sometimes we may have to cross-reference ICD-9, okay? All right, now, for acute care, they use what they call revenue codes, okay? DRGs, which is diagnosed related groupings, revenue codes, DRGs, they use some, and it just depends, some CPT codes if it's dealing with physical therapy, occupational therapy, maybe even speech therapy if the person had a stroke, and other type therapies, maybe even like chiropractic care, something while they're in the hospital. And for DMEs, DMEs are your durable medical equipment. Okay, these are the durable medical equipment is basically, let's see if I can slide this over because it's kind of looking like from an angle. Yeah, hopefully I can see that. I'm sorry. I should have wrote in black. Should have written black because I can't see that on the screen too well. Okay. Your durable medical equipment is those places that deal with wheelchairs, such as home health. Okay. Visiting nurses. Hospice. Palliative care. Those type of things. Okay. So if you're going to be a medical biller in that aspect, working for home health agencies, then these are some of the things that you're going to deal with. Can you see it, sweetie? Okay. These are some of the things that you're going to deal with. And these mostly, they mostly use the Hicks-Picks coding book, and they mostly use the CPT. And they also use the ICD-10. Okay, but that should already be written on the referral when the hospital or the nurses tend to refer the patient out to maybe like a skilled nursing facility or a rehab type place. They should already have that in line. All the home health agency has to do is look on the referral and administer what's needed: wheelchairs, Hoyer lifts, walkers, IV feedings, Glucerna, different protein drinks and things of that nature. If a person had a colon bag, they need colon bags because they had a colonoscopy done, and they need to exchange their colon bags out. Some use, they're not picks, but they're catheters for urine type purposes. You'll be dealing with all of that beautiful stuff. So that's what all that is. So that's why it's important to understand medical terminology in cases and understanding and perspective of the specialist. Okay. So did everybody get a chance to write this down? I'm going to take a picture of it. I usually take pictures and I email it to the students. So I haven't emailing it to you guys. So forgive me. I'm texting it to you guys, picture check. So I'll have to catch up on that this week. We'll take a picture of it. Okay, hold on just a minute. Take that picture right quick. When you mean as far as like billing goes? Yes. It's more critical. Yeah, it's more critical because when you're doing inpatient coding, you have to take into an account the days that the person stays in the hospital and what's all accounted for. And you have to read the nurse's notes, yeah, and the physician notes that corresponds with the discharge status. Oh, the DME. Okay, that is not as critical, but it needs to be just as watched because they do send patients home with a wheelchair or a walker, and that has to be billed to the insurance company. So yes. Mm-hmm. When we get to that chapter, because you all are learning, I think in chapter 5, y'all are learning diagnosis codes, and in chapter 6, y'all are learning procedure codes. And so as it goes deeper, we'll start looking at the CMS 1500, as well as we look at the UB04, and there's a difference between the two. There's a difference between the two. But that's a very good question that you asked. So, yes, it's not as critical, but it still needs to be watched because in hospitals, I know from being a biller of home health before, they have a specialized closet where they will send a patient home on a walker. You know, a patient, come in emergency status, had a stroke, and they rehabilitated, they're doing well, but they need help, getting around home. And so they send them home, or if they're in a wheelchair because they fractured their leg, they send them home with that. And then what ends up happening too, after they send them home from the hospital with that, then they contact, because I used to do this with Memorial Hermann. They contact the home health division, which where I worked at, and then we have to continuously bill for that durable medical equipment monthly. And then they send out nurses and everything, or oxygen tanks if a person needs an oxygen or a CPAP machine. Then we have to continuously bill for that. So yeah, so if you're going to do acute care billing, you start up the billing process, and then if they are sent home with DME stuff, then a separate biller for the DME department will continue the billing process. Mm-hmm. Mm-hmm. Very good question. Anybody else have questions? Okay. And is it safe for me to erase the board now? Okay. I promise I'll try to keep it within dark colors and not in red and green because I see it's not showing up on the computer screen too well. So I'll try to keep it within a good color range for you.
So DME is basically repetitive unless you get like a new patient. DME is basically repetitive unless you get a new patient.
It is either way. It's repetitive when a person is in the hospital and they sent home with durable medical equipment,
Right.
and also if the doctor from the doctor's office said, you need a CPAP machine. We've done a sleep study on you. You need a CPAP machine.
And is that separate billing?
That's separate billing. Mm-hmm. That's separate billing. And so what ends up happening from a physician's office on an outpatient standpoint, they send a referral over to a home health agency for the new billing of that product. Mm-hmm. Mm-hmm. Absolutely. And now you have some doctors, especially if they're family practice or pediatrician, And they deal with fractures or something. And if it's not something so serious where they have to do a closed reduction or open reduction type surgery procedure, we'll talk about that. If they don't have to do that, and it's something that they can manipulate in the office, put a cast on you and send you home on crutches, that is durable medical equipment. Now, the biller for that family practice physician or that pediatrician would have to bill for those crutches. Some things like that for crutches or slings, it's not monthly. It's just a one-time bill and that's it. But if it's a walker or a wheelchair, something that's durable, something that can be recycled. Mm-hmm. Now, crutches can be recycled, but some people, once they finish crutches, they can donate them. And it happened at Memorial Hermann, where I've worked, and we just donated to charity. For folks that have like Medicaid, Medicare, they can't afford that ongoing bill like the commercial insurance people. Then we just donated because it's recycled. It's a durable equipment. It's recyclable. That's why they call it durable medical equipment. Mm-hmm. So yeah, again, for the DMEs, you have to use the HCPCS book because they have codes for every little device you can name. They have codes for it. Okay. So going on to page, I really tore this book up. I got paper everywhere. Jesus. Okay. All right. So we have cardiology, urology, gastroenterology. We're going to look at some of these cases right here. Radiology, endocrinology. There's intervention radiology and intervention radiology. They deal with like what I just had, a kidney biopsy. So they have to use a CAT scan to find exactly where the kidney is located on that person's body and then extract from there. Orthopedics, page 192. Nephrology, okay. Neurology, and then we have a case here where a person living with Crohn's disease, okay? Crohn's disease. So let's go back to case 1 and look at that. Okay, so cardiology. So we're going to look at the terms over here on page 185. And so while I'm writing this up on the board here, if I can get some volunteers to take the first 3, that'll be Shaylee, the second 3, that'll be Teresa, the third 3, that'll be Amy, and the last 3 will be Ebony. And look those up, and then we're going to talk about it as after I finish writing this. Okay. Okay. All right. Fantastic. So, we'll get some volunteers to come up, and you can write in either um, blue, black, or purple. I'm going to remove this green and this yellow. This green and red, because they're not good colors for the screen here. Okay, so ready, Amy? Okay, so go ahead and put your 3 up there. Okay. Oh, wow. That's good.
We missed one right here.
I am.
Anticoagulant.
Oh, thank you, sweetie. Thank you so much. Am I missing another one?
Maybe this one right here.
Okay. Thank you. You ladies are doing really great. Wow, I didn't know you were that many. Okay, very good. Very, very good. Okay, so it reads as still. Let's see here. Let's go back and put all this together. Mr. Rose was admitted to the cardiac care unit for angina, which is a sharp pain in chest resulting from sudden decrease of blood supply to the heart muscle, and a history of hypertension, which is high blood pressure. A coronary angiogram, where is coronary angiogram? Okay, an X-ray of blood vessels surrounding the heart, showed a spasm, which is involuntary muscle contraction of the right coronary artery, causing acute myocardial ischemia, which is a sudden decrease of blood flow to the heart muscle. The electrocardiogram showed ventricular arrhythmias. So do we have ventricular arrhythmias? Abnormal heart rhythm originating in the lower chamber of the heart as well. Nitroglycerin, which is a drug that relaxes the muscle and opens the blood vessels, was administered within minutes, and the angiogram showed reversal of the spasm. The ECG recorded reversal of life-threatening arrhythmias as well to prevent further ischemia and myocardial infarction, which is death of tissue and heart muscle. Mr. Rowe's treatment will include antiarrhythmic diuretic, antiarrhythmic, is antiarrhythmic up here? Yes, pertaining to a drug that works against or prevents abnormal heartbeat, a diuretic, which is a drug that causes kidneys to allow more fluids to leave the body, and an anticoagulant. Is anticoagulant on
That's
the
the one
board?
I wrote in.
Oh, that's the one you wrote in. Okay, thank
Real
you.
small.
Okay, thank you. Anticoagulant is a drug that prevents blood clotting. In the future, he may need additional procedures to place a stent in his coronary artery to keep it open. Now, do you see how important it is to understand med terminology in reading the cases? And how I read it out is to help you think exactly what's going on, to kind of picture an imaginary thing in your mind, what's going on with that person. And so that way you'll know how to code. So it's going to get a little bit more deeper as we go. So it gets easier. And again, anything that you learn in school, starting from kindergarten on up to college, is learned in layers. It's learned in layers. Okay? Okay, so this is what I'm going to do. I'm going to give, just like the way I read it, I want Shaylee to do number 2, case 2 of 186. Teresa do oncology, 187. Amy do radiology, and endocrinology will be for Ebony. Okay. See here. And then we're going to read about Crohn's disease. And once we read about Crohn's disease, we'll pick out what's going on with that as far as the different terminologies on there. Then we move on to chapter 6 today too, which is dealing with body systems. So we're going to understand body systems and how it also relates to operative reports and how it also relates to electronic medical records. Okay, and that's a wrap for this class.